Yeah, the Martini-Klinik is the only European institution which is specialized only of the treatment of one disease, and we are specialized for the diagnosis and treatment of prostate cancer patients. Usually the contact to the patient ends when the patient leaves the clinic. We try to build up a lifelong relationship with the patient. So the patient receives, before he comes to the hospital, he receives some questionnaires about his quality of life, some prostate-specific questions, and when he comes, he has to further answer some questions about his disease history. And but even if he leaves, the patient receives 7 days after surgery, 3 or 6 months after surgery, and then every year when the surgery is 1 year longer ago, he receives a questionnaire. And we started with this in 1992, and we have now data from 23,000 patients in our database, and many of them have a history of 20 years and more, and they still receive a questionnaire every year. The next patient generation profits from the previous patient generation, because all the data accumulate in this database, and you can find some, let's say, nearest neighbor, and you can make more stronger predictions that a patient who has a prostate cancer with a Gleason 3+4 in 40% of the prostate, 58 years old, will have these follow-up PSA increase or not increase. You can compare, or you can predict some things easier. That's one thing. On the other hand, we have learned a lot of this in terms of continuous improvement. So measuring outcomes is a strong driver for medical innovations, because suddenly you see some differences and you question yourself, what does this mean? And then you can react on this. So one example, in the very early years, patients who had positive lymph nodes, you would have stopped surgery in Germany due to the guidelines. Because when the pathologist says, well, the lymph nodes are positive, there are some lymph node metastases, you don't continue to take the prostate out. So, and the Martini-Klinik surgeons just continued to take prostates out, waiting for the frozen section analysis. And then they recognized later on in looking to the data in the database that there's a big advantage in quality of life for these patients, where you get rid of the most hard tumor burden. So there's no healing, no cure, but there's a big benefit in terms of quality of life for the patient. So finally the guidelines were changed in Germany that you should take the prostate out even if there are some positive lymph nodes. First of all, start as soon as possible. Spend effort to question yourself what is important for your patient. Yeah? For prostate cancer, it's very easy. Patients want to be cured, they want to be continent, and they want to be potent after surgery. And but for other diseases, you have to find which is the question. What is most important for the patient, because outcomes is always what matters to patients. And then you have to build up your database structure to easily registrate all the data and to make easy analysis of this. And usually no common hospital information system is capable to do this, so you have to spend some effort to develop your own or try to find a solution for this data management. And it's an invest. You have to invest in the infrastructure. You have to invest in the employees that do this. But it's an investment that really pays off.